brain is an integral organ, pivotal to mental well-being of every individual. This organ, interconnecting with other biological factors, determines the behavior of humans. It is quite easy to avoid the one on tattered clothes, as it outrightly communicates the mental status of the individual. But not every well-dressed, notable individuals are mentally healthy. In their minds lies a high degree of unpredictability, known to some but unknown to many, which is why we experience unimaginable behavior in the society in our daily interactions with people. This acute human problem is no respecter of status. It is a global issue experts seek solutions to world over. Every 10th day in the month of October is annually set aside by the United Nations to commemorate World Mental Health Day. This year's theme is tagged Young People and Mental Health in a Changing World. The mind is the engine room of every human's life, as every man is a product of their inner thoughts. The vulnerability of the mind of the young people enables fast external influence that could affect their entire well-being from adolescence through to adulthood, thereby aborting their great dreams and aspirations in life, which affects the home, community, and country, as the young are the future of every nation. According to statistics by Mental Health Foundation in United Kingdom, 20% of adolescents may experience a mental health in any given year. 50% of mental health problems are established by age 14 and 75% by age 24. 10% of children and young people between age 5 and 16 have a clinically diagnosable mental problem. Yet, 70% of children and adolescents who experience mental health problems have not had appropriate intervention at a sufficiently early age. To seek personal solution to their predicaments, young people resort to drug and substance abuse. The intake of tramadol, marijuana, and other steroids is now trends amongst young people. These alarming discoveries and its impacts on various communities prompted the Legends, a community-based organization, to organize the awareness and sensitization program for secondary schools within the various communities in Ejigbo Local Council Development Area to celebrate the global event of World Mental Health Day.
We all gather here today to mark World Mental Health Day, a day that is observed on 10th October every year, with the overall objective of raising awareness of mental health issues around the world and mobilizing efforts in support of mental health. Today provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide.
And Mr. Kiwi, that used to be a gentle boy, began to misbehave.
It was an audiovisual interactive session with students as seasoned resource persons took turn to make their presentation with slides discussing in-depth courses of mental disorder, consequences of drug abuse and addiction, as well as enlightenment on those charged with the responsibility of drug prescription.
Remember, your brains are still growing, so these substances are very, very harmful to your brains, particularly Indian hemp. So we're saying that we know from research Indian hemp can cause mental illness. Then when people do have mental illness, so because of the mental illness they are having, they'll be introduced to Indian hemp or substances to reduce the symptoms they're having. And on the other hand, taking these substances can also cause mental illness. So the advice is don't even try it. It's not worth it.
Our life is full of choices. Some people are where they are today because of the choice they made. Sometime early this year, I think around the month of March, we had on the news that a little boy in the Ejigbo local government of Abia State, This boy, it was time for inter-house sport in his school. And this boy needed to excel in inter-house sport. He wanted people to clap for him. He wanted to do the unusual in inter-house sport. You know what he did? He decided to go to the pharmacy and then he bought Tramadol. Somebody say Tramadol. What did he do with the Tramadol? This boy did not take one capsule of Tramadol, he didn't take two. He took 10 capsules of Tramadol. You know what happened to him? He died. He couldn't survive it. He died. That is a choice he decided to make.
The truth is, the doctors and pharmacists are the ones that are being trained to know how a drug reacts in your system, what to do if there are, if there are overdosage of such drugs, or if you intend to limit the action of a particular drug for a point in time.
Resource persons stress the need for parents to pay adequate attention to their children, as this will help to avert mental disorder, its early detection, and how to help the children against the evil of stigmatization. They urge the students and members of the public to be wary of activities that could lead to mental disorder and not seek drug or substance abuse to overcome any problem in life.
Let us be friends with our children. And let us add, both parents and teachers, please, we need to listen to these children. It's because when we listen to them, we'll be able to pick if there's anything wrong with them.
I have learned a lot today, and I've kind of known the different types of drugs, how we can talk to our students, especially concerning peer influence and other ways by which they get involved in drug abuses. So we'll kind of consciously or unconsciously be able to talk to them either during teaching or outside or when we are having extracurricular activities.
What I learned so far was that drugs are not meant to be misused or abused. We should always be with the doctor. We should be in touch with the doctor because of our health. Because health is wealth.
I learned that not all those that you see around you are okay mentally. Some people appear to be okay physically, but in there they have some disturbance within them, and you shouldn't just neglect all those suffering from mental trauma. You should learn to show them love and recognize what exactly is their problem. Then you should call them and be able to tolerate whatever their problem is.
Mental disorder, drug abuse and addiction is rampant in our society today. Addressing these young ones is a top-notch approach in disseminating the information faster, as they make up a significant number of the community population. With this strategic measure, facilitator and dignitaries present opined that the message will travel wider in the community and help curb the menace to secure the future in order to create a serene and healthy society for all.
It is not enough that my kids, my family, my neighbors won't take some of these drugs that could affect their mental health. It doesn't have to be your family, it doesn't have to be your neighbor, but it's the same community in which we live. We use the same vehicle with them, the same public bus, the same bus stop, the same worship places. So there's no how we can fix this without fixing the problem in the community, because the community is where all of us we interact. So if it is not, if we don't have a victim in my house, I may have somebody who will be sitting with me in the same bus that has mental disorder.
When all of us are well, we are healthy. So that means we can function. I talked about what is the meaning of being mentally healthy. That means you can function. You know your own ability. You do what you're supposed to do. You function in your home. You function at work. If it's students, they function well in school. They pass their exams. They leave school when they're supposed to go. And when they're supposed to leave, they're not on substances, you know. So the community will be healthy.
I think it should be a dream of every parent, every practitioner, every community stakeholder to have a very free drug community, drug abuse drug-free community.
While the legends pledge to continually sensitize the young and seek government intervention, others urge the government to put in place more awareness programs, facilities for rehabilitation, policies backed with severe punishment for offenders as a deterrent to drastically eradicate this age-long life-threatening societal problem.
Whatever we do today, the government needs to do more than whatever any NGO or CBO is doing. The moment our government begin to carry out measures against people that traffic what they have banned, other people will take it as a no-go area.
If they can subsidize the treatment in hospitals, make policy put into effect the Mental Health Acts, there's consideration, NHIS, mental health is there, the admission, if they're going to be admitted, they're not going to spend 2 days, 3 days, if it's malaria, if it's an infection, surgery, spend 1 month, 2 months. All that has to be factored in the Mental Health Act. So these are the ways that government can come in